Great, thank you. Thank you all for joining us tonight. So if you think about from academic achievement to peer relationships, sports performance, and to any of a number of current events, there are a range of things today that can cause stress and anxiety for our children. So we're fortunate to have Dr. Seth Laracy here with us tonight to talk with us about ways to raise less anxious children. Seth earned his PhD in school psychology from the College of Education, and he worked for 7 years as a school psychologist, working across settings and across age levels with children and youth and families before joining us again at the College of Education. He's a clinical supervisor for all of our practicum and internship students in school psychology, and we're certainly glad to have him back, bringing his expertise and sharing that with us tonight. So thank you again for joining us this evening, and I look forward to hearing more of what you have to say, Dr. Laracy.
Thanks, Dr. Hodnowski, and thanks everyone for joining us today. When Dr. Hodnowski asked me to think about giving one of these talks, I had to spend a little time trying to think about what topic to go with. And as Robin mentioned, I supervise our students here, so I'm kind of a generalist, whereas most of our faculty are really specialists in a certain area. So I had a lot of topics to draw from, or potential topics to draw from. And I decided I wanted to talk about anxiety for a couple of reasons. First is anxiety is a big problem among our kids. Recent research indicates that about 16% of adolescents are diagnosed with an anxiety disorder. And those rates are only going up. They've increased by about 61% in the last decade. And that's not just the recent events, pandemic and on, they increased by about 27% before COVID came along. So we're up to about 16% of adolescents, and it seems like those rates are going to continue to increase. In addition, other research has indicated that about 9% of our students, our kids, are also experiencing what we would call like subclinical levels, amount of subdiagnostic amounts of anxiety. They're anxious, though they don't necessarily meet criteria for an anxiety disorder. All told, that puts about 25% of our kids, about a quarter of our kids are having some significant anxiety. A lot of this research has looked at adolescents, but my experience working in schools really, told me that a lot of kids, even at the elementary level, are dealing with anxiety. So I wanted to talk about it because it's a big concern, and one that I know that a lot of parents or a lot of teachers, a lot of folks with kids in their lives are thinking about. It's also something that my work in schools, made me think that there are things that we as parents, we as educators, we as just people who care about kids are doing that we're trying to help the kids that might actually be inadvertently making things a little bit worse. And at the same time, there are really effective strategies that a parent could adopt that I think I can maybe teach you in about 20 minutes that might actually help make things a little bit better. So for those reasons, I was excited to talk to you guys about anxiety today. I want to say at the onset, there's a lot of ways you could go in talking about anxiety in youth. So I just wanted to tell you some of the things that matter, that have potential, that are things we should address, but we're not going to talk about today. There are a lot of things in the world, most of them on the left side of the screen: social media, the pandemic, which I think we're still feeling some of the effects of that, school safety, climate change, economic uncertainty, the threats in addition to the potential of AI. Those are all things that have a lot of us worried. Kids are dealing with academic stress, overscheduling, some of the stress that we put on them. And then there's biological factors like sleep, nutrition, genetic background that could be playing a part. People also will talk about how maybe these increasing rates of anxiety are due to the fact that we're acknowledging that it's there, whereas we might have ignored it some in the past. So all of these are important, but many of these are things that are going to be beyond our control to fix in the short term. So I wanted to talk about the things that we could. And to do that, I want to talk to you a little bit first about learning theory. So that we can understand a little bit about how kids tend to become anxious in the first place. This is a short talk, so we'll talk about these just very briefly, but we'll talk a little bit about classical conditioning, social learning, and operant conditioning. These are some of the most basic ways that human beings learn. So first, if you've heard of classical conditioning, you probably have. You've probably heard of Pavlov and his dogs. And the idea with classical conditioning is that when two things happen together and one of those things matter, they tend to start to get connected over time in our minds, and even on a non-conscious level. And it's important to understand that where does anxiety come from? Where does, fear, dread come from in a child or an adult? One of the most direct pathways is classical conditioning, the pairing of something scary with something that's not scary, and then the thing that's not scary becomes scary over time. The classic experiment from this, and this is not an actual, the actual images from this were old and fuzzy, so this is my foray into AI. But the classic experiment, and this was the Little Albert experiment, conducted way back in 1920 by John Watson and Rosalie Rayner. What they did is they exposed a little child about that age, named Albert, to a white rat. And though some of us might not like rats, they're not necessarily fearsome to babies. They're cute little animals. So at first, Albert had no fear of this rat. What they did then is they started banging striking a metal bar, making a loud noise that would startle him. And they did that when he was presented with the rat. And pretty quickly, he started to feel fear and distress when he would see the rat, even if it wasn't paired with the noise. So the fear he would feel at the sounding of that noise was transferred to the rat. And indeed, over time, it was transferred to other things like the rat, things like rabbits, fur coats, I've read even a Santa Claus beard. So if we have an experience with something that's rather innocuous, like a cute little rat, but it's consistently paired with something that's really scary, we start to be scared of that innocuous stimulus over time. Um, and so that's one of the keys to understanding where a specific fear or where a specific anxiety comes from. Another key that, particularly for those of us that are adults in the lives of children, is to recognize that while there aren't too many gongs being played when things happen, one thing that cues them to be happy, afraid, to have an emotional response is us. And the kind of second learning theory is social learning or social referencing, is well-supported theory that shows us how our responses become encoded by children over time. And the classic experiment here, this actually is a picture from that. Was conducted in 1985 by James Source and some colleagues. It's called a visual cliff study. So as you can see here, this baby is on a glass platform that has a table immediately under it for part of it, and then part of it looks like there's a cliff. Now there's a piece of glass there. It's load bearing. The baby can crawl over that. What the experimenters did is they had the child's mother stand on the other side and either make a face that showed that she was smiling or looked interested, showed no fear. In those cases, that infant would crawl over that visual cliff about 3/4 of the time. When the mother showed a fearful facial expression, none of the infants did so. They all stayed back. So they had effectively just learned the fear from their mother. And throughout their lives, kids pick up on fears a lot from us. A couple examples that I've come across in my work or in my life. I had a supervisor on internship who told me that she had a colleague who knew this phenomenon very well, and she had a daughter who was a little bit, not terribly, but a little bit afraid of dogs. And she was walking down the street with this woman was walking down the street with her daughter and saw a couple of blocks away there was a man with a dog walking towards them, and she figured we got to get to the other side of the street eventually. We're going to cross early. I'm not going to even bother with trying to deal with her being afraid of this dog today. I don't have time for that. We're going to cross now. And they crossed the street again, a couple of blocks away from the dog. And as soon as they stepped out into the street, the little girl turned to her mother and said, "See, Mom, you're afraid of dogs too." So the kids can be very keen to these responses that we have. Another example, I have a friend who has always had a fear of having their belly button touched. And I found out at some point that their mother also had this fear. And I don't think there's any gene for a fear of belly button being touched. And I don't think anything terrible. Nobody's banging a loud gong whenever my friend was touching her belly button. But I think what happened is that her mother didn't like this, and she had a strong emotional response when my friend touched her mother's belly button, her own belly button. And that emotional response taught her that there's something to fear there. So I think the second key to understanding where anxiety comes from is to learn that it is to know that it can be learned from those around us, particularly our caregivers. And finally, our last little bit of learning process is operant conditioning. And for those of you that were psychology majors or you remember operant conditioning, that's essentially that when a behavior is followed by something that is a reward to the individual, they tend to do that behavior more in the future. In the case of anxiety, the behavior that's often elicited by a fear response is escape. And this picture is actually my son. He's not escaping anything here. He just loves running, walking down the street. But when we have a fear response or an anxious response, and we uh, avoid doing the thing that's making us nervous, we feel better. That feeling better is a reward that reinforces the escape and also reinforces the intensity of the anxiety that forced us to escape. So when, again, when this is the third kind of key process to understand is that when a child or an adult avoids something that makes them nervous, it tends to make the nervousness, the fear, the anxiety worse in the future. So, I'm talking about these processes here because they really pretty succinctly point us to a few simple strategies that we can use to decrease to help the kids in our lives, help prevent them from learning anxious responses, and help them overcome anxious responses when they're kind of just starting to have them. So my advice is it was popping up in these next few slides. The first bit is to try to express fear and worry only if you want your child to become afraid. And there are certainly times when we want this to happen. If your child is reaching for a hot stove and your facial expression says you're afraid of that or you're angry about that, and they become afraid of touching hot stoves in the future, that's a good thing. I actually think we probably shouldn't be encouraging our children, this isn't controversial really, but to walk over apparent cliffs because we want them to be afraid of going over the edge of objects. What we don't want them to be afraid of uh, are things like socializing, taking acceptable risks, ordering in a restaurant, things like that. So, what I would encourage you to try to do is to whether you're a parent, a teacher, or a coach, is try not try not to do that and or try to at least recognize that those responses may have a lasting impact on the child. Now, I know most parents are pretty anxious, and telling somebody with a child or working with children, don't be anxious or just suck it up is hard to do. So I'm not saying we should never, not to overly worry if you worry a little bit. But if you do worry a lot, to think about some of the worry that you have and try not to that you don't want to pass on to the children in your life. And if you can model confidence when faced with those situations, you can pass that on to your kids instead. One thing I was thinking about when putting this together is that one of my oldest memories, and it's so old that I'm not even sure if it's true. I don't know if I made it up or not. Is I remember as I had two sisters and we were little kids and our neighbor was playing in a little wading pool. We really wanted to do that, and we went in and asked our parents if they could ask him for us. And I don't remember how my parents responded, but I remembered feeling really embarrassed and afraid for my dad to have to go out there and do that. And I imagine to some extent he probably was like, I don't want to do that. Like, mom, you talk to him. And then what I internalized though was like asking somebody that we played with all the time to play was scary. And to this day, I'm still a little bit scared of social initiation, if I'm being honest with you. I probably wouldn't have volunteered to do this talk. I'm happy they asked me, but I wasn't going to go out and seek an opportunity. Somewhere along the way, I learned to be a little bit afraid of those things. So now when I have children, I try to not pass that on. The next two slides are kind of, when you start to see a little bit of anxiety in the children in your life, I think the key thing to remember, if you remember only one or two things from this, I would ask you to try to remember this, is that strategies that make anxiety better in the short term can make it worse in the long term. And the picture here is of a girl crossing the street. So think back to that example I shared a moment ago of my supervisor's colleague who crossed the street to avoid a dog several blocks away. Well, that made that little girl's anxiety better in the short term. She had noticed the dog. She was starting to get nervous. And when she crossed the street, she wasn't nervous anymore. Her heart stopped racing quite so bad, and she felt relief. So that made it better in the short term. But again, that escape is going to make that anxious response stronger in the long term. Uh, so the next time she sees a dog, she's more likely to seek out escape. Um, the converse of this is true as well. Strategies that make anxiety worse in the short term, like walking past the dog, will make it better in the long term. Facing your fears in a manageable way is what helps us to overcome them. And I think this is, as I was talking to Bryce before, other reasons why I wanted to, give this talk is when I worked in schools, I saw a lot of anxious kids, and I saw a lot of parents and teachers who really cared about them. And what they were almost always asking for was for us to come up with some accommodations that made the child less anxious in the moment. And I tried to explain to so many teams the logic behind this, that like actually whereas we want the children to be this, our students, our children to be less anxious in the long term. Sometimes that means allowing them to be a little bit anxious now. But having a child that you really care about provoking anxiety or worry, or allowing them to sit with that anxiety or worry, can feel really bad to us. We care about the kids. We don't want them to suffer. So we don't do that. And I'm going to be honest, when I was talking to anxious parents of anxious kids and anxious teachers of anxious kids, I've convinced very few people to do this. So I wanted to talk to some people when it wasn't so emotionally charged. We're not talking about a specific child, and say that, this is, when if you're working with a school psychologist, a counselor, or if you're just trying to do this on your own, knowing that, making it a little bit worse in the short term can really help in the long term is really key. So, you know, an example of how you could, do that is to support them as they, face things that make them a little scared. And this again this is my little guy. This is Augie, and he loves the little playground that's behind Grandpa's house. He loves sliding. He was actually never afraid of sliding. He's happy to go down those. But a couple of weeks ago, we were up visiting Grandpa, and he was flying down the slide and having a good time. And then a neighbor with two kids that were about 2 and 4 years old, they came up, and then Augie immediately walked away from the playground and walked over to the dog park area and started to play with some of um, the toys over there. And I stopped and I thought, like, well, that's okay. He could do that, but he's avoiding something that's making him a little bit anxious. So what I did is I walked over to him and I said, I mean, I probably talked to him, but he doesn't know too many words just yet. But I kind of guided him back to the play area, and I walked him up the first couple of stairs, and I said, "All right, go down the slide, buddy. You can do this." And he went up and he went down the slide again. And then the other two kids came over and they started playing with him. They tried to teach him to play tag, so they're running around tagging him. He had a wonderful time, and made a couple of friends. Um, and a child's life with their parents, with their teachers, with their coaches, with um, folks at church and the community, there's thousands of hundreds of thousands of little opportunities to learn to face your fears, or learn to run from them. And I think our goal as adults in the lives of the kids should be to help make sure the times that they face their fears outnumber that. And we can do that very gently and very compassionately. And the earlier we do that, the stronger the effect will have. And now he gets to go flying down the slide and have that nice smile on his face all the time. Um, Another thing we could do is to recognize the things that we're doing around our children's anxiety. In this example, this little boy here might be a little bit afraid to sleep alone. So his dad is doing a very reasonable thing and lying on his floor next to him. But what a lot of research has recognized is that those things that we do to accommodate the child's anxiety teaches them that they can't really handle that situation on their own. It teaches them to rely on somebody else to decrease that level of fear for them. So some very effective clinical treatments focus on for anxiety for children, focus on some of them focus on working with the child, but some of them focus just on working with the parents and getting them to stop doing some of these things. That one of those treatments is called supportive parenting for anxious childhood emotions. That's where I'm taking the word accommodate from, or abbreviated as SPACE. A wonderful treatment that works with parents to help them learn to stop doing some of the things that might be maintaining their child's anxiety. So in this case, if this father were to stop sleeping in his child's room, that would make the anxiety worse in the short term. Um, and it might lead to a couple of rough nights. But it would almost certainly make that child's anxiety better in the long run. And that's ultimately our goal as adults that care about parents, is to help them to have a long successful life where they're able to face life's challenges, with a team, but with some independence. One of the big examples I would see of this in schools is I realized in one of the schools I was working in, we had a new principal, and he came in and he noticed that we had uh, dozens of kids in the school that had accommodations where we were supposed to tell them if there was a fire drill because they were a little bit afraid of fire drills. Now, we had a couple of children, particularly children with autism, that had some very intense sensory needs that was really appropriate for. But there were many kids that were just a little bit afraid of them. And we worked to get those kids to recognize that in the long run, they would be better off facing that fear of a fire drill, knowing that nothing bad is going to happen when that happens, and supporting them through that. So if you notice that you have anxious children or slightly anxious children in your life, and that you're doing a lot of things to help make that anxiety a little bit lower, you might want to think about in a sensitive and we'll talk in a second about a gradual way of changing your behavior so that you're making them a little bit more uncomfortable in the short term, so that they can be a lot more comfortable in the long term. And to that piece about doing it gradually, it's important to know that like you don't need to get to the finish line of an unanxious child immediately. If we think of that, so you could take it a step at a time. If we think of like in this example, a father who's laying next to his son who's sleeping because he's afraid to be alone. If that father were just to say one night at bedtime, I'm going out to the hallway, you can cry all you want here, that actually would kind of work probably eventually, but it would be really tough on everybody. So what he could do instead is say, you know what, I'm going to lie here uh, tonight, and tomorrow I'm going to lie on the other side of the carpet. I'm still going to be in your room, but I'm going to be a little farther away. And maybe do that for a night or two, and then say, all right, now what I'm going to do is I'm going to be in your room, but I'm going to stand here and with you while you fall asleep. I'm going to stand in the doorway. And then he could say, all right, I'm going to walk, I'm going to stand in the doorway. I'm going to come back, but I'm going to go and use the restroom and come back. And then you can extend the amount of time that he's away. You could do it gradually so that there's less pain. When I was working in school, I had a student who was very afraid of fire alarms. And what we did is he had been allowed to leave the school before a fire alarm for several years. But that probably wasn't going to happen the next year when he went to middle school. So I spent some time with him, and I knew in advance when the fire drills were. And I said, all right, what we're going to do is for this first fire drill, we are going to go stand, you're going to come to my office beforehand. We're going to stand right outside together when it goes off. And this was a student who was so nervous about fire drills. He knew if we didn't have one, you're required in schools to have one every month. So if we hadn't had one by like the 31st of March, if we hadn't had one before this morning, the 31st of March, he would not come in the building. So we started with, all right, I'm going to tell you when it is, and you're going to stand outside with me. And the next month, I would say, we're going to stand in the foyer here, and we're going to let the fire alarm go off. You're going to hear it in the building. We're going to walk out. The month after, it would be we're going to be in my office, which is right near a door. And as soon as the fire alarm goes off, we're going to walk out the door. And slowly work till he was able to spend more time in the school while the alarm was going off. It's a little bit harder to think about, how to make these steps for some things like social things. Communication can be a little bit tougher, anxiety to deal with. In those cases, I want you to know there are effective treatments. If if your child or a child that you work with, a child that you care about or love, if you know they're actually really struggling with anxiety, there are really effective treatments for that. Some of them, like in this picture, would involve a therapist working directly with the child to help guide them through exposing themselves to some of the things they're afraid of, to think about those things differently. And some very effective treatments, like I mentioned, the space treatment earlier, would actually just work with the parents and teach you. It's not that it's the parents or a teacher's fault if something's wrong. It's that a parent can make changes in the environment that will really support long-term growth in the child. So if you are if you do, care about a child who's really struggling with anxiety, I would encourage you to seek some help for it, because we have really effective treatments for that. And through those treatments, the children and the people that care about them can learn to make some small changes to the way they're acting that can have some really long-lasting impacts on how comfortable they are in their skin and in the world. So I think, yep, that's all I got. I think I'm roughly on time here, Bryce. So you can let me know if I if I did. But I think we certainly have time for questions if anybody has any.
Yeah, no, that was right on time, Seth. That was a great wrap up. So as you know, Dr. Laracy said, everyone, if you have any questions, please feel free to drop those in the chat. We've got about 20 or so minutes more of the presentation, so plenty of time for conversation and to address questions that you all may have. The first question that I want to talk about is like, Seth, do you think that they could do the Albert study in modern day, given the ethics standards that are required of research studies? Because I can only
No.
imagine that
Yeah.
in the 1920s that they were like, let's expose this child to a rat and then bang a gong and see what happens. Like, I can't imagine any ethics board that would allow a study like that to happen today.
Yeah, and thank goodness for that. Like, partly we're, I wish they didn't do that to poor Albert. And I should have. I used to. There's some follow up if I forget how he turned out. But yeah, in order to do that now, you would need to say that you think you can condition him to be afraid of things,
Mhm.
and that's really kind of a mean thing to do. So yeah, that wouldn't be the most ethically um, upright thing to do.
Yeah,
I,
definitely not.
I also kind of think that like we probably shouldn't do the visual cliff study either because you don't really want to inadvertently teach kids that approaching, seeming drops and going over them fearlessly is a good idea. But there are certainly things you can do to decondition that.
Yeah, absolutely. So kind of going back to your final point there about some of the effective, kind of tools and methodologies to support children and support teenagers who are experiencing some anxiety, like what are some of those specific techniques or styles or approaches that either a parent or a teacher or a counselor might use to support, the child in their life that's experiencing that?
Yeah, I mean, I think in the simplest version, it's just a lot more detailed and structured support of the things I told you today. I don't want to go too far, but you've been sharing with some of my supervisees a treatment called Match ADTC. It's a modular treatment that has lots of nice little therapy techniques that can be used for a wide range of concerns. And for depression, they have about 7 or 10 different active treatments. For problem behaviors, they have 7 or 10 different modules you can use. And for anxiety, there's pretty much one, um,
Mhm.
and it's exposure. There's because that is and there's cognitive techniques you would work to where you talk about what are you afraid of, but the really effective part of treatment is exposing yourself, exposing the child to the thing that they're afraid of. And again, you can do that where it's helpful to have a professional is you could do that very gradually. It doesn't have to be, um, if you're afraid of dogs, you want to like throw somebody into a dog pit.
Mhm.
But you would work with if you were doing an individual therapy through like a cognitive behavioral therapy, you would work through work with a therapist who would be skilled at breaking that up into manageable chunks, which might start with let's say you're afraid of a dog. All right, I want you to imagine you're in a room with a dog. Maybe you'll teach them some relaxation techniques. All right, how anxious are you getting? Can you bring that down a little bit? Now, I
Mhm.
want you to imagine you're in a room with a big dog and it walks up to you and licks you in the face. Oh, you see its teeth right there? Oh, you're getting pretty
Mhm.
anxious? All right, let's calm down. And you would work up to like exposing them to actual dogs.
Mhm.
Um,
Absolutely.
the treatment with working with parents conversely would work to have parents stop doing some of the things that are accommodating the anxiety. And I think that to me, I think the reason why that is really effective, and it's just as effective as working with the kids, is that naturally brings about the child having to be exposed to manageable bits of anxiety themselves.
Mhm.
And that does lead to good effect over time. I think both treatments have about a 60% effectiveness rate at um, getting the kids to not meet criteria for an anxiety disorder anymore.
Mhm. Wonderful. So we're gonna go to the chat now. We've got a couple of questions that have come in. So Sarah wants to know, Sarah's a school counselor, recommendations for working with high school students who are experiencing social anxiety. This is something that I was thinking about during your presentation, is oftentimes anxiety is a response to a fearful outcome or a negative outcome. And for a lot of people, you getting into a car and getting into a car accident, there's anxiety as a result of that. But social anxiety and rejection from one's peers is can be highly damaging to an individual also. So what would you maybe recommend for someone who's working with high school students experiencing social anxiety?
Yeah, uh, similar strategies. And I love this question because I think it highlights like it's easy to think about how do you kind of titrate exposure to a dog.
Hmm.
You can imagine it. You can have a little dog, then you can have a big dog. You can have it come up to you, can have it jump on you. But kind of titrating and controlling exposure to social situations is a lot more difficult. And it's important that those exposures go well. So like you wouldn't you don't want the student, whether it's a dog or a social exposure, to have a bad experience because that can reinforce the anxiety. So I think in that case, what you would want to do is we're thinking about high school, so you're going to have a student who can really have some insight into the things they're afraid of. You would want to have them make one of the techniques is called a fear ladder. So you can start by talking about like let's make a list of and work with the student to do this. Let's make a list of situations that you're really comfortable in, situations that make you a little bit nervous, situations that make you a little bit more nervous, situations that make you really nervous, and situations that you're not going to do um, because it's too hard. And then you would start at maybe you teach them some techniques to help relax themselves and overcome that anxiety and start at the bottom and say, all right, so you said you're really comfortable talking to your one, friend Maria. Um, but when her other friend comes along, you're really nervous about that. So what I want you to do is to like, call Maria and see if she and Patty, can come over this Saturday and start with something that's a little bit anxiety provoking, but not, but something that's within the ability to do that. You want to make sure that the extra friend you're inviting is not a bully, is not somebody is somebody where like it's reasonably going to go pretty well. But as that student has, more and more exposure to social situations that cause some anxiety, they'll be able to move up that ladder to a harder one. Um, something like social anxiety is probably not something you're going to get over in a day.
Yeah, absolutely. It's one of the tricky ones because you're
Yeah.
in social environments all the time.
And just also like thinking about the number of negative social interactions in the real world and online that kids are exposed to.
Mhm.
There's a lot of trials of socialization that can potentially go wrong. So it's a very tricky one.
Yeah, awesome. So Michelle mentioned, thank you for your insight and professional expertise. As an elementary school counselor, your webinar is going to make me consider a lot more whether or not it would actually be beneficial to add in the quote, prior notice of upcoming fire drills in 504s. So yeah, I think that's an interesting approach. Seth, what are your thoughts?
Yeah, I will say good luck. I worked in an elementary school that had a lot of anxiety, and I made this pitch dozens of times, and I think that accommodation went into most of the 504s because and I think that's also sometimes appropriate because what I would view my role as is I'm going to explain to the team exactly what should happen here. And this actually does follow a pretty predictable pattern. If you give that accommodation, they will be less anxious when the fire drills come up. And to some extent, that's okay. There's not that many fire drills in the rest of life.
Mhm.
If it's not generalizing to anything else, one thing I always thought as a psychologist and I was saying to my students is that treatment shouldn't be worse than the problem. So if it's going to be much worse to expose them to fire alarms than it is to let them escape it,
Mhm.
that's kind of okay. But but I would I would view it as my job as a school psychologist to always kind of really explain that to a parent and a team because if the team is thinking we're going to do this and it's going to make the anxiety better and then the anxiety is going to go away, we kind of know that that's probably not true. And I would view my job is to inform the team about what the likely outcome is if we give the fire drill accommodation and what the likely outcome is if we don't give the fire drill accommodation. And then let the team, and if the child's old enough to be part of it, decide what they want to do.
Mhm. Wonderful. So Caitlin asks, can you share some insights around school avoidance and helping parents navigate in-person learning versus opting for virtual? I'm sure that there's probably a lot of cases of
Yeah.
this after all of the experience that students and children went through going through COVID, being locked up and not having those social interactions. And I remember even back to my own childhood, the friends that you'd have that would their parents would drop them off at school and they'd be screaming and crying from that separation
Yeah.
anxiety. So what do you think about some maybe techniques or some approaches around school avoidance and parents that are in that in-person versus virtual format?
Yeah, I think some of the most memorable and impactful cases I've encountered in my life dealt with this, because this is a little bit more. It's easier to see how there's potential long-term harm to school avoidance than it is for fire drills. Like I said, there's not that many fire drills once you get out of school. That's okay, but social environments where you have to be around other people, if you learn early in your life to avoid those, that can be a pattern. It doesn't always lead to long-term difficulty, but it's a pattern where it's easier to see how it could. So, I think that to me, the key to that is, trying you want to have some understanding of why. What is it about the school building that the student's afraid of? And I'll use a deified rough example of a kid that I worked with once who we had some school avoidance, and he was about a third grader at the time, I think. And he was afraid, and actually it was funny. I was just talking to a student about a very similar student, a kid today, but he was afraid of throwing up, which is actually a common fear some kids have, throwing up or gagging, that can lead to school avoidance. So what I did in this case was I tried to figure out, it's actually, I think, a good example of a lot of things we realized. Where did this come from? And I realized his in talking to his mother, who was very collaborative, that she had a condition that led her to throw up a lot. And we talked about what happens when you throw up? And she would say that she would run to the bathroom. She hated throwing up. Nobody likes it, but she hated it. She would like close the door, tell the kids to leave her alone. And I said, all right, so actually, I kind of want you to do this instead. Say, oh, mama's got to throw up again, but I'm going to feel better afterwards. And go to the bathroom, leave the door open, model that it's something that you can do. So we started targeting it on that side. We also, I also started when working with a child, the team, what people usually do in that case is say, like, well, you don't worry about it. You're not going to throw up. We stopped doing that. We started saying, you might throw up and it'll be okay, to model that like it's going to happen, and it probably it might happen, but that's also an imagined exposure. Now the child is getting some time to think about that and to overcome it. And then, this is, if you didn't see this, you probably wouldn't believe it, but like this child would, he would jump out of the car on the way in. He would be standing in the doorway, and his knees would be banging together. Like you could just see the anxiety on him. Um, and as soon as we got walking to the classroom, he was fine again. As soon as he got over that hump, and his body, the non-conscious part of his brain that processes this, realized that that escape wasn't going to work, he integrated back in pretty well, and he had a phenomenal teacher and had lots of positive experiences, and the kids were very welcoming and loved him. So, the key was just trying to slowly, gradually get him back into the building, to not let him escape that. And we were really successful in getting him back in the building. Now, the every kid is going to be different. I think a lot of kids, the trigger to this is a social anxiety, but or it's just wanting, uh, it's more comfortable to be at home. There's any number of reasons, but understanding that reason, and then if school is something that's causing them fear or anxiety, kind of trying to slowly build up their exposure to it. I've seen at times that schools being, having the flexibility to say like, all right, we're going to start by having you come in for, and if a student hasn't been in for a year and they want to come back, we're going to start by having you come in for um, one class. Do the rest virtual, but come in for one class, and you pick the class that they like the best, that's going to go the smoothest, and you build from there.
Yeah, wonderful. So we've got about 5 minutes left. There's a couple more questions that
Sorry,
I
I'm
want to
giving
see
you
if we can
too
try and
long
get
of
to before we
responses.
finish. But no, this is great information. We just want to make sure we get the most out of the time that we have. So Emma Kramer is a elementary school counselor, and she is wondering if you have any recommendations for kids and students who use social media to, quote, escape from their anxiety. Typically, she suggests reading, meditation, exercise, but a lot of people say that they actually feel more anxiety surrounding disconnecting from their devices, which is a really interesting approach. I actually had a professor in one of my courses in college that he made it an assignment that everybody had to leave their phone, basically locked
Yeah.
in their room for 24 hours. And I noticed within, a few hours of being away from it, like I had that anxiety of like, where's my phone? Where's my phone? Where's my phone? So, and I was, 20, 22 at the time. So yeah, what are your thoughts around social media use and anxiety and that idea of being disconnected as a source of anxiety?
Yeah, I love the way both of you are framing that, because I think this is one of the most complex questions to deal with. And I was really hoping to get out of here without talking about social media and these things, because
Hard
it
not
is so
to.
difficult, and it's also a frequent focus of arguments with my wife, because she's pro social media and I'm against it. But I think it's important to recognize that it functions in a couple of different ways. That it is the way people connect to social support. It is, a positive tool for a lot of people. And it is a way that negative influences and anxiety provoking influences get in. So it can cut both ways. I think it is the to kind of the at least the quotation mark part of Emma's question. It's the escape part that is probably most directly worrisome from an anxiety treatment standpoint. So now we all escape anxiety, we all do it all the time, and most of the time it's fine. But if you notice there's a pattern where like if the child really wants to be uh, socially engaged with friends, they want to be going out playing basketball, but they're using social media to escape from their anxiety. It's not the social media that's the problem, it's the escape. Um, and that would be the same if it's reading or it's exercise or if it's other things. Now, those other things I think in general are probably particularly exercise, meditation, those things are more clearly and unambiguously healthy, I think. Um, but but there's but that using that as to escape is difficult. Or is where some of the difficulty comes in. So, I would try to say like that social media works differently for different people. Again, my wife gets a lot of calmness and connection from that. I get a lot of anxiety from it. There's just too many things, and so it has a different response. And to recognize that people are going to be different in that. But I would try to have a conversation around that, and then try to steer people towards, yeah. But if that's what you really want to be doing with your time, great. If you're using that to avoid something that you would rather be doing with your time but is stressful to you, let's work on that.
Wonderful. So I think we'll probably get through one more question before we kind of wrap things up for the evening. So Kristen asks, I have a friend whose daughter has a lot of anxiety associated with her severe peanut allergy. She's in third grade. Any advice for the parent on how best to handle this at home when her daughter's anxiety is heightened? That's interesting. So she has more anxiety when she's at home in a controlled environment than she does maybe at school. It's an interesting dynamic.
Yeah, yeah. And kids never stop fascinating you. Sometimes you could, because you might predict the other one, and some kids would be worse at school, some are worse.
Mhm.
The anxiety would be worse at home. I think I would you know approach that in a couple of ways. One would be to have, and I'm sure that this has actually probably already been done, to be really clear about like, here's a plan for a peanut allergy. We don't have peanuts at home. We don't have we have an EpiPen here. So if something were to happen, we are perfectly equipped to handle that. We as your parents know how to deal with that. You as a smart third grader, you know how to deal with that. So though there is some risk here, the risk is really minimal.
Mhm.
And I would make sure that that's really clear, that's really known. And then I would not say that over and over again. And this is
Mhm.
where I'm thinking about the things that we do to accommodate anxiety can breaking that chain can be helpful for a parent. So my guess would be this is what I would do as a parent, if I didn't weren't trained not to. Um, I would spend a lot of time saying that over and over again. Now, sweetie, like that we like, let's go look at your EpiPen. All right, see it's right there. Mommy knows how to use it. Daddy knows how to do it. We've done training about it. We've taught you how to do it. Your brother knows how to do it. So, like, I would say that to comfort them. But what like a treatment like space or thinking about stopping accommodations, would advise you to do is to recognize that that actually is prolonging the anxiety.
Mhm.
She's using, parents to get over that. So I would uh, um, shorten that to a simple phrase. We have a plan for that, and just say that. Don't
Okay.
give that reassurance. Give less of that. Um,
Yeah. So rather than prolonging and repeating the response of
yeah,
like we're in control, we're in control, we're in control, kind of
yeah,
hitting the gist of it over and over again, just trying to keep it simple so that way
yeah,
they're not constantly thinking about the potential outcome.
yeah, yeah. But that's a
Wonderful.
tough one because that's something that like, you do
That
want
could
her to
have
be afraid
very
of
real
peanuts,
consequences.
but
Yeah.
you don't
Yeah.
want her
Peanut
to be
allergy
afraid of
has
it.
very
Yeah,
real consequences if it's
yeah.
if it's not managed. All right. So with that, everyone, thank you so much for joining us. We are at time. I would say if anybody has any additional questions that we were not able to get to, please feel free to reach out to me. I'm going to drop my email into the chat right now. I'd be happy to forward any questions or information that you're looking for, and I need to send that to everybody, not just hosts and panelists. That's my apologies. Um, Uh, different 222 at
And I will say, I don't know if anybody does have questions that they really were hoping to have
Mhm.
answered, please feel free to pass them along. I will reach out with a response.
Yeah, absolutely. So anybody that has questions for Dr. Laracy or wants to have some further conversations around either techniques or approaches or suggestions around managing anxiety for children in your life, then we're happy to help you find ways to be able to do that. So thank you to Dr. Laracy. Thank you to the College of Education for a very interesting and insightful conversation around childhood anxiety. And for those of you who are still on, we will be doing some more webinars for the College of Education for the next couple of months. The next one is going to be with Professor Elise Sitani, and she works with the Lehigh Autism Services Department. So that'll be very interesting. And then we also have some additional presentations coming up in May with other faculty from the college. So thank you all for joining us this evening. Have a good night, and we will see you guys in the next one. Thank you very much.
Thanks, everybody.